My name is Jess Kreppel, a board-certified behavior analyst and licensed behavior specialist with Brett Denovi & Associates.
And my name is Alyssa Kinkade, a registered behavior technician with Brett Denovi & Associates. Today's video will review provision of services to families in need.
As siblings of learners with disabilities, Alyssa and I wanted to provide a few friendly reminders to our fellow disseminators of ABA.
Here are 3 things to keep in mind as you enter the new school year with your learners and their families.
It's hard to ask for help. Many families who are in need aren't sure where to start when it comes to seeking ABA services. There is an overwhelming amount of information out there, and sometimes it's challenging to narrow down the options. Even when options are narrowed down, unfortunately, some families' initial experiences with ABA aren't exactly the best, creating a negative learning history and challenging future buy-in. In fact, according to a recent article published by Jessica L. Rohrer et al., interpersonal interactions that are experienced as directive, impersonal, and lacking in compassion are unlikely to lead to continued services, empowered families, or positive experiences with ABA. It is important to use elements such as discussing the rationale for selected targets with the family, ensuring the rationale is aligned with the family's input, as well as asking questions about general family functioning and individual members.
In the words of Greg Hanley, board-certified behavior analyst, doctoral and research professor at Western New England University, for $1 million, what would you do to turn off challenging behavior? Many families know the exact answer to this question, if only they are asked. And sometimes, the answer to this $1 million question is used by families if it makes for a successful family vacation or trip to the grocery store.
As clinicians, we often have the ability to clock in and clock out of our sessions. For our families, sessions with loved ones are 24/7. Just as you do with your learners, meet your families where they are with each new day and continue to reassess your clinical recommendations. The majority of us know how important it is to pair with a learner at the onset of a case, but it's equally important to pair with a family, and this pairing process should never stop. Your learners are the most important beings to the families you serve, and one of the biggest challenges for families is learning to trust someone else with their loved one.
Thanks for taking the time to view our video, and best of luck in the new school year.